Hello, it's Dr. Jeffrey Spiegel speaking on behalf of my wife and I, Dr. Onir Spiegel, for the Spiegel Center and the AAFPRS injection course. Let's first talk about a glabellar rhytid. A deep glabellar rhytid is going to be caused by muscle movement, of course, but there are times when relaxation alone is not going to do it. Here you can see Dr. Onir is injecting Dysport. Dysport we mix such that there are 10 units per 0.1 cc, and we consider that to be a dose. That makes the calculation of how much is used very easy. And then we'll often use partial doses to inject into these areas. For a deep rhytid like this, however, relaxing the muscles may not be enough. And in this case, you can see that we're adding filler as well, some Restylane Refine. Now, we use a cannula here because this is a very vascular area, and you need to be cautious about intravascular injection. It can be challenging, as those of you who use cannulas know, to get the cannula in. But once you get it in, you're going to track right deep to the dermis in this area, along the deep rhytid, and put in just enough to fill up the area, a little bit underfilling, because once the relaxant kicks in, the muscles are going to debulk, come down a bit, and flatten out, thus taking away some of this. And if you've filled this rhytid to it's perfectly smooth at the skin level, you're going to find that you've overdone it and there can be some excess puffiness in the area. So again, a cannula is a very useful thing here. You can see in Dr. Onir's left hand, she's got a small vibrating device. This takes away some of the pain of the area. There's another person getting their glabella treated with Dysport. And again, in this case, what we're trying to do is put in tiny aliquots. We used to do just a few doses, but putting in tiny aliquots we've found works even better. Crow's feet is a common area, of course, to treat with any kind of relaxant muscle. When somebody has thick, heavy skin like this, you're really trying to elevate the brows at the same time by targeting the muscle in very precise ways. And again, multiple doses in multiple areas seems to be better. It's a very superficial muscle, so the injection needs to be only just beneath the dermis. Again, this vibrating device, which you can put into a finger of a disposable glove and thus keep it clean, and of course you'll wipe it down between uses, makes the comfort significantly better. And you can see here how rhytids, even all the way up to the corner of the eye, to the lateral canthus, can be improved. Temples can be a problem in both aging and in people who are very thin. So, as you know, we do a lot of facial feminization and thinking of gender, and of course, hollow temples are a somewhat masculine feature, which goes along with advanced age. Something like Restylane Lift, or something with a bit of a thicker lifting consistency, is good in this area. It can be put right into the temple, into the temporalis fossa there. And of course, we track down along the zygoma into the cheek for a nice smooth curve in this area, which I think is a nice touch. You follow along the periosteum of the bone there and then up into the fossa. Again, the vibrating device inside the glove helps a lot. As I was saying, if somebody has a very thinned face, or is heavy into exercise, runners, people like that, temple hollowing can give you premature aging as well as a masculine look by showing off bony contours. Once again, filling in the area is a very nice way to round out the forehead, increase the width of the face in this area, and it's very feminizing and attractive. This is good for older women as well as young. The glabellar transition into the nose is something that is an important thing to consider in overall attractiveness. In my talks and work on facial feminization, we know that a prominent glabella leads to a masculine, unattractive, and older look. So smoothing out this area at the radix can be very helpful. A small amount of lidocaine can be used to create some numbness for insertion of the needle, followed by insertion of the cannula to smooth out this area. When somebody has a larger dorsal hump on their nose, or in this case they have a dorsal hump and then almost a bit of saddling beneath it, inferior to it, you're going to treat both of these areas in the same way. It's important to know that with non-surgical rhinoplasty, you can only augment the nose. So no one's nose is going to be smaller. However, once you've camouflaged humps and irregularities, you're going to get a nose that's more balanced and attractive and hence less noticed. Ultimately, the goal of somebody is to have a nose that's not noticed, because that's what an attractive nose really is one that blends in with your face and does not stand out for having any particular irregularities. Once again, a cannula is a nice way to do this. The vibrating device inside the glove takes away a lot of the discomfort, and all of our patients will use ice before the procedure as well. Commonly, Dr. Onir will utilize 1/10 of a cc of lidocaine prior to putting in the needle as well, especially in people who have a history of being squeamish with injections or other things. You can see you can reduce the hump. You're not going to want to necessarily take it away completely, because that would be too much at the radix. Similarly, you can smooth out noses that are looking deviated to the left or to the right, or that have small post-surgical irregularities. Tear troughs are an area of particular discussion. In fact, in surveys, many people who do aesthetic injections to the face will report that they are hesitant to do tear troughs. The tear trough, when it flattens or is flattened, again leads to an elongation of the lower eyelid, hollowing in the area, and a prematurely aged look or a masculine look. Anterior fullness along the submalar area and the anterior cheek is a very feminine thing, and of course the lower eyelid should be very short as it transitions into the anterior cheek. We again like to do small amounts of this, fairly deep, tracking along the periosteum. It's very important to underfill when you're doing tear troughs. And you shouldn't only do medially, or you're going to look too full along the nose. Here you can see we're filling in as we track laterally as well, using one of the Restylane products. And this tracks out into the temple and along the zygoma. The vibrating device can be used to smooth out the area just as well as your fingers, and it's quite comfortable when you do that. Again, tear troughs in somebody who's a little bit older can start to be a concern, and as we know, the number of people who are seeking lower lid blepharoplasty or receiving lower lid blepharoplasty has likely substantially decreased as tear trough injections and the injections along the lid cheek margin have become more commonly done. A single entry point can typically achieve all you need to get the filler in along the entire course from medial to lateral, although at times, as you'll see, Dr. Onir likes to use a needle instead of the cannula for tiny little touch-up injections as she works her way from medial to lateral. Gentle movements back and forth ensure that not too much of the filler goes in any one place, and thus you're not going to get as much post-injection fullness. You have to stay in a deep plane, and you want to underfill somewhat because these products are hydrophilic and will attract water, and you're not looking to get a bluish discoloration or any kind of superficial puffiness. You should certainly have a handy supply of hyaluronidase in your office if you're going to start out doing tear trough fillers, because it's easy to overfill and it may be necessary to remove a little bit with hyaluronidase. Again, somebody who's fairly young but starting to show signs of aging as her lower eyelids are extending down due to hollowing prior to the anterior malar area. We're going to fill this in by putting in the cannula after the needle and working our way from medial to lateral in a transition from the tear trough out towards the zygomatic arch. Again, staying deep and being ready to massage it at all times. Some people request not to have the vibrating device, in which case you'll displace the skin and be ready for sort of a bimanual approach to feeling and thinking about how much filler goes in. You want to pay attention to the readings on your syringe so that you're not over-injecting and so that you're being at least fairly symmetrical between the left and the right sides. Of course, perfect symmetry in the amount injected may not be necessary because people will have asymmetries in the amount that they need from one side to the other. You definitely want to think about how you transition this into the malar eminence, because an over-injected look is certainly not popular in the Massachusetts area. Out here, people strive to look like nothing was done, and they all have natural beauty that was unadulterated and untouched. And you can see how her lower eyelids are shortening. Again, a very short lower eyelid as it transitions into the cheek is a sign of both femininity and youthfulness, and hence beauty. You'll want to choose a product here that is not quite as thick, because of course this skin is very delicate, and you do not want one that is excessively hydrophilic, or else you can get an unexpected amount of swelling and fullness in the area. We have people use an iced roller, which has been kept in the freezer and of course sterilized regularly between patients, to reduce swelling and to make this much more palatable and comfortable. People can be icing the side that's coming up or the side that was just done. It also gives them something to focus on as they're being injected, so they pay less attention to the needle going in and thinking about that, and more to their task of handling the ice and moving it around as you've instructed them to. These little tips can greatly increase patient satisfaction with the procedure and create the impression of a very comfortable and smooth event. Once again, tiny little aliquots of filler might be necessary without the cannula, although you have to be cautious because this has an increased risk of causing bruising and complications. When these little tiny droplets are done, they're fine-tuning the result at a somewhat higher plane. So you do think about putting in your filler in layers where you've gone lower and then higher. Using the little vibration device in your hand, as well as having a piece of gauze and your injectable, takes some skill and training. Here you can really see how the lower eyelids have been improved and the tear troughs have been blunted with this technique. And in older people with looser skin, a surgical approach might be what you'd recommend, but if it's not what they want, you can get significant improvements with fillers. Injecting lips are, of course, very common and very popular. Our approach to injecting lips involves using a combination of a cannula and a needle, a combination of laying a strip of the material as well as using tiny little pearls as in a droplet technique. Needle is introduced just inferior to the vermilion border, just along the vermilion. The cannula is introduced, and of course it can be difficult to get this in. You have to pay very careful attention to where your needle hole is placed. You stay just on the vermilion side, and then we tend to inject as we go out. And it's very helpful to use 2 fingers on one hand, feeling above and inside the lip as you inject, so that you can really feel for the amount going in. A lot of this is done by feel. The resistance should be very low. When you're in the right plane of injection, the cannula slides in extremely easy. We'll do lip augmentation surgically with fascia grafts, dermal grafts, or the like, and once again, getting in that plane is critical for achieving a result that's natural and without complications. If you get into a plane that's too high, too low, too deep, or too superficial, you can get blebs, necrosis, unnatural swellings, and the like. Paying attention to the amount of material you put in, I think, is particularly important on the lips, as is looking for any asymmetries that are present prior to injecting and explaining them to your patient so that she or he is aware of their starting point, and then they'll notice that they have an improvement afterwards rather than seeing any kind of asymmetries that might remain and assuming they are due to your injections. Cannulas reduce the risk of bruising, although of course they don't make them zero. Ice seems to help, and arnica. Now, here's a tip for lips, which many people may not be doing, which is that, of course, we do a lot of lip lifts surgically in the office, and we recognize that getting a good lip roll and having some tooth show is important. There's flattening of the philtrum with advancing age, and it looks masculine and less attractive. So a bit of filler placed into the philtral ridges provides support to lift the lip, define the cupid's bow, and it's very attractive. Then Dr. Onir likes to place tiny little droplets of the material with a needle along the vermilion border to provide a bit of a lip flip, really it's not a technical lip flip in the sense of using botulinum for this, but it provides a supportive ridge there which defines that area. After those little pearls are placed, you can massage with your fingers to make sure it's smooth and even. Periorbital rhytids can be injected by putting an aliquot of the material into them and then using 2 fingers, one inside the mouth and one outside, to massage it into the area, providing that extra volume and some hydrophilic material in the area does just enough to smooth out those areas and improve them. For the lower lips, we tend not to use the cannula, but rather to use a needle to put just a couple of deposits along the pillows of the lower lip to the left and to the right of the midline. Some people will use dental floss even to define that. Additionally, a little bit along the lower lip vermilion border can be used to provide a little bit of a pout, which can look very attractive. Once again, touching up perioral lines. Now here's a woman again. You can see she's a young woman. Her lips are not particularly full, and she's lost a bit of her philtral ridges. You can see from the frontal view they're a little flattened, and she doesn't have much of a roll along the vermilion border. Similar approach. And here we are filling in along the philtral ridges. Initially, it can look too strong when it's first done, and you might think, oh dear, I've enhanced that too much, but it's going to soften, particularly with massage and pushing on it. We're not talking about long-term massage either. We're talking about an immediate massage. Again, after the cannula technique is done, little aliquots of material can be put right at the vermilion border, just beneath perhaps, to give you a little bit of a roll. You don't want to have a overly standardized technique. You really want to be customizing what you're doing based on what you're seeing. Many people complain about their lips falling down as they get lateral. And this technique of injecting a bit into the vermilion beneath the vermilion border can plump that up. Surgically, we'll do a banner lift or a sweetheart lift along the lateral edge of the lip. You can see here how the lips have better definition but still look natural. Again, in Massachusetts, we're not looking for that excessively filled in look. Thank you for your attention. We look forward to answering any questions either now or via email.